And I want to bring in Democratic Congressman Glenn Ivey of Maryland. He's a member of the Appropriations Committee. Congressman, the ball is in the Senate's court right now because Republicans in the House already passed what they're calling a clean continuing resolution. In fact, that's something that we did hear from the majority leader in the Senate, Thune, mention. He said in a vacuum, this would get all Democrat support because it's clean. It doesn't have policy agenda priorities of Republicans on the bill. What's your reaction or response to that?
I mean, it overlooks H.R. 1, the big ugly bill that they passed that created this healthcare mess that the Democrats are trying to help the American people get out of before everything rolls in. So, the clean, dirty, whatever they want to call it, at the end of the day, notices are about to go out to the American people that their healthcare premiums are going to double or triple. All these procedural arguments they're making will be meaningless to the American people. All they're going to want to care about is, why are my health care costs going up to a point where I can't afford it anymore? And who's going to fix it? This stuff that the Republicans are talking about now doesn't address that concern.
I hear you, but a shutdown would also create a lot of pain for so many of your constituents, right? 11% of your district, some 40,000 people are federal employees. How do you respond to those who may question why Democrats are putting their jobs on the line?
Well, I think my constituents are telling me their jobs have been on the line since January 20th. I mean, the Trump administration has been a bulldozer when it comes to firing federal government employees, no matter what they're doing. They might be doing clinical trials for Alzheimer's. They might be doing work to address, healthcare issues and vaccines and the like. I've got people in my district who've been laid off for some of the most critical work that the government service can provide, and have been getting excellent reviews for 20 and 30 years. They've still been pushed out. So I think my folks recognize that this stuff about he might push us out unless we, bend the knee, they know that they can't trust Donald Trump, and they know what he's been doing to them for the past 9 months.
We've heard from multiple Republican leaders, the vice president, the House Speaker, and other Republicans that they're claiming Democrats want to fund free health care for undocumented immigrants. They're tying that to your health care priorities. We should note undocumented immigrants are ineligible for federally funded health care programs. They can't buy plans on the Affordable Care Exchanges, but that is the narrative Republicans are hammering home. It's what many of their voters are seeing and hearing. What's your response to that?
I mean, it's fundamentally dishonest, and I think it reflects the fact that they don't have a legitimate argument that they can make. The bottom line is the $1 trillion cuts to Medicaid were really, aimed at paying off the billionaire friends that Trump wants to help out. So it's a transfer from the needy to the greedy, essentially. And the health care cuts with respect to the ACA is a direct attack on regular people who need those benefits to pay for basic healthcare services, critical healthcare services. So they'll start talking about, illegals. Sooner or later, they'll probably go after transgender too. But at the end of the day, when those notices show up at those people's houses that their healthcare rates are about to triple, they're not going to care about all of that stuff. They're going to want to know how they can make sure they can maintain healthcare services for themselves and their families.
It is starting to get ugly, though, after yesterday's meeting with the top 4 leaders on the Hill with the White House. We saw the president post that fake video mocking Democrats pushing the racist replacement theory. Then we saw Jeffries respond by posting a real photo of Trump with Jeffrey Epstein, which brings me to something I want to ask you. Could releasing the Epstein files become part of these negotiations as some kind of leverage?
I think the Epstein files are going to come out sooner or later, no matter what. They can't drag their feet forever on that. The top priority, though, is not the Epstein files. It's health care for the American people. It's restoring, the Medicaid funding, because we've got elderly and disabled and children who are relying on those funds so they can get basic and critical health care services. Same with respect to the cut to the tax credits with the ACA. So we need to focus on that. I think that's where the Democrats have been. The Republicans are trying their best to avoid addressing the mess that they've created. We're going to force the issue.
Democratic Congressman Glenn Ivey of Maryland, appreciate your time. Thanks for being with us.